Anaphylaxis, emergency management. Question. A 32-year-old woman with a history of peanut allergy accidentally consumes a peanut-containing dish at a restaurant. Within minutes, she develops dyspnea, wheezing, hypotension, and generalized urticaria. Which of the following is the first-line treatment? A. Intravenous corticosteroids. B. Intramuscular epinephrine. C. Diphenhydramine. D. Albuterol inhaler. Correct answer, B. Intramuscular epinephrine. Explanation. Type 1 hypersensitivity reactions are IgE-mediated and occur immediately upon antigen exposure. Common causes: food allergies, peanuts, shellfish, insect sting latex, penicillin, contrast media. First-line treatment, IM epinephrine, never delay. 2. Allergic rhinitis, seasonal allergies. Question. A 25-year-old man complains of sneezing, clear nasal discharge, nasal congestion, and itchy eyes during the spring and fall seasons. He denies fever or facial pain. What is the underlying mechanism of his symptoms? A. IgG-mediated immune complex formation. B. IgE-mediated mast cell degranulation. C. Delayed T-cell-mediated response. D. Complement activation. Correct answer, B. IgE-mediated mast cell degranulation. Explanation. Allergic rhinitis is a type 1 hypersensitivity reaction triggered by pollen, dust mites, pet dander, mold. Pathophysiology. IgE binds to mast cells and basophils, causing histamine release and inflammation. Treatment. Antihistamines, intranasal corticosteroids, allergen avoidance. Asthma. Allergen-induced bronchoconstriction. Question. A 10-year-old boy with a history of asthma experiences wheezing, cough, and shortness of breath after exposure to dust and pollen. What is the best long-term management to control his symptoms? A. Inhaled corticosteroids. B. Intravenous corticosteroids. C. Montelukast only. D. Oral diphenhydramine. Correct answer, A. Inhaled corticosteroids. Explanation. Allergic asthma is a type 1 hypersensitivity reaction triggered by environmental allergens. Acute treatment, albuterol, short-acting beta agonist, SABA. Long-term management, inhaled corticosteroids, ICS, long-acting beta agonists, LABA, if needed. 4. Urticaria, drug-induced allergic reaction. Question. A 28-year-old woman is prescribed penicillin for a streptococcal throat infection. Within 30 minutes, she develops raised erythematous pruritic wheals on her trunk and arms, but no respiratory distress. What is the most appropriate next step? A. Discontinue penicillin and observe B. Administer antihistamines and corticosteroids. C. Perform desensitization therapy immediately. D. Give intramuscular epinephrine. Correct answer B. Administer antihistamines and corticosteroids. Explanation. Urticaria is a localized type 1 hypersensitivity reaction caused by histamine release. Common drug triggers: penicillins, cephalosporins, NSAIDs, contrast dyes. Treatment: oral antihistamines, H1 blockers, plus corticosteroids if severe. 5. Insect sting allergy, risk of anaphylaxis. A 45-year-old man is stung by a bee while hiking. Within 5 minutes, he experiences generalized urticaria, facial swelling, and shortness of breath. What is the most appropriate immediate intervention? A. Oral antihistamines and corticosteroids. B. Intravenous fluids only. C. Intramuscular epinephrine. D. Watchful waiting. Correct answer C. Intramuscular epinephrine. Explanation. Insect sting allergies, bees, wasps, can cause anaphylaxis, type 1 hypersensitivity. Epinephrine is life-saving and should not be delayed. Patients with a history of severe reactions should carry an epinephrine autoinjector, EpiPen. 6. Latex allergy, occupational risk. Question. A 32-year-old nurse develops itching, swelling, and wheezing within minutes after wearing latex gloves at work. What is the most appropriate next step? A. Prescribe corticosteroids. B. Advise latex-free gloves and epinephrine autoinjector. C. Perform skin patch testing. D. Order a complete blood count. Correct answer, B. Advise latex-free gloves and epinephrine autoinjector. Explanation. Latex allergy is a type 1 hypersensitivity reaction common in healthcare workers, patients with spina bifida, and frequent surgical patients. Common triggers: latex gloves, balloons, condoms. Severe reactions require epinephrine and strict latex avoidance. 7. Food allergy, egg allergy and vaccination. Question. A 4-year-old boy has a history of severe anaphylaxis to eggs. His parents ask if he can receive the MMR vaccine. What is the most appropriate recommendation? A. Avoid MMR vaccine due to risk of reaction. B. Administer MMR vaccine without restriction. C. Give MMR in a hospital setting with observation. D. Perform allergy testing first. B. Administer MMR vaccine without restriction. Explanation. MMR vaccine is safe for children with egg allergies because it contains minimal egg protein. However, influenza and yellow fever vaccines require caution in egg allergic patients. 8. Drug-induced anaphylaxis, radiocontrast media. Question. A 58-year-old man undergoes a CT scan with IV contrast. Within minutes, he experiences shortness of breath, facial swelling, and hypotension. What is the underlying mechanism of his reaction? A. Type 2 hypersensitivity. B. Type 1 hypersensitivity. C. Type 3 hypersensitivity. D. Type 4 hypersensitivity. Correct answer, type 1 hypersensitivity. Explanation. Contrast media reactions are often IgE-mediated, type 1 hypersensitivity. Premedication with antihistamines and corticosteroids may help high-risk patients. 9. Oral allergy syndrome, cross-reactivity with pollen. Question. A 23-year-old woman with seasonal allergies experiences lip and throat itching after eating fresh apples and peaches. Cooking the fruits prevents symptoms. What is the most likely diagnosis? A. Food poisoning. B. Type 2 hypersensitivity reaction. C. Oral allergy syndrome. D. Histamine intolerance. Correct answer, oral allergy syndrome, OAS. Explanation. OAS is a type 1 hypersensitivity reaction due to cross-reactivity between pollen allergens and certain raw fruits vegetables. Common triggers: apples, peaches, carrots, celery, birch pollen cross-reactivity. Symptoms are mild and avoided by cooking the food. Would you like more questions on specific IgE-mediated reactions, such as exercise